Record. Okay. So last time I attempted to introduce or answer the question, what is cancer, from the standpoint of view of Western medicine, or what is called standard of care these days. And I talked a lot about genes, and that might give the wrong impression that our destiny is determined by our genes. And thankfully, that's not true. So even in patients who have a mutation, a known mutation in their BRCA gene or other genes, we often see that the percentage or the risk of developing some sort of cancer as it relates to that particular gene increases. But we never tell them that you are at 100% risk of developing this cancer. And often in medicine, we doctors are trained to look for the problem and just focus on the problem and focus in, okay, how we can now deal with this. For example, if a patient has BRCA mutation, they would immediately have a consultation, counseling, genetic counseling about what are their options. And the options, whether in somebody who has a mutation or in general population, when they talk about cancer screening, sometimes they use the term prevention, which is not an accurate term, because no matter what we do, we cannot guarantee, and prevention is a strong word, to prevent cancer. Meaning it sounds like that we have tools to 100% guarantee that you're not going to get if you do this and this and that. But in screening in general population, what we are attempting to do with the screening is to either reduce the risk of getting a cancer by eliminating factors that can cause cancer, or even more importantly, to catch the cancer at an earlier stage. Because obviously, the earlier the stage is, the more likelihood there is that we can treat it successfully. So for example, for women, in the general population, we say, start your mammograms at age 40 and do your colonoscopies starting age 50, and this sort of things that when we go to our general practitioner, they usually order us at certain times. And if we have a family history for a certain type of cancer, for example, if I had a family member who had colon cancer at age 45, then it's too late for me to wait until I turn 50 to get my first colonoscopy. So the rule of thumb is that if you have a family member who got a certain type of cancer at an early age, then you need to do the screening test at an age which is 10 years younger than the age that family member got it. So if I have an uncle who got colon cancer at age 45, my first colonoscopy has to be at age 35, not 50. So that's how we adjust. But in those who have a mutation, for example, BRCA mutation, we may talk about removing breast. We say if you remove both of your breasts, you cut your risk of breast cancer by 95%. We don't say 100%. Why? Because breast generally is a type of tissue that doesn't have a capsule around it. So the breast cells are kind of in between the muscles on our chest wall. So even in the hands of best surgeons, when a double mastectomy is done, about 5 to 10% of breast tissue is left within the muscle fibers of the chest wall. Or if we tell them that if you remove both of your ovaries, you reduce your risk of ovarian cancer by 95%. We never say it's 100%. Why? Because the lining around our bowel or peritoneum, genetically, when we were embryos, they come from the same tissue. So somebody who has BRCA mutation, even if they remove their ovaries, they can get what is called peritoneal cancer, which is the lining around the bowel, and it acts very much like ovarian cancer. So this is a good segue to discussion of today. And today I want to talk about epigenetics. Because epigenetics is the science that basically give us some control over our destiny, and does not believe that our genes are going to determine our destiny, which it used to be, everybody thought like that. Okay, whatever your genes are, that's what's going to happen to you, because they decide what diseases you're going to get and all of that. But epigenetics doesn't say that. Epigenetics is a science that discusses or shows and does research on how our behaviors, our lifestyle, and our environment would affect expression of our genes. Mm. Yeah. So just because we have a gene, that doesn't mean that it's gonna be expressed. Mm. We touched base last time on how we have tumor suppressor genes, how we have genes that do DNA repair, how we have a programmed cell death, apoptosis. These are all mechanisms that our brilliant bodies have to nip in the bud any cancer that starts. And as I said last time, even those of us who don't have cancer, many times in our lives, a process of cancer has started in our body, but our own immune system and all the other mechanisms that I mentioned has stopped it. Now, in epigenetics, what happens is that our environment or our behavior, lifestyle affects the DNA or the gene material in a way that they either express certain gene or they silence a gene. So we have promoters, we have repressors, and the best example of it is how a baby is made. So when conception happens, a sperm and an egg, they fertilize and they create this cell that we call it a zygote. This cell, one individual cell, then starts dividing, and DNA of all of these cells are absolutely identical. These cells are identical. And at some point, during the growth and development of the fetus, all of a sudden, some of these cells become bone, some of them become liver, some of them become muscle, some of them become brain. That's really a classic demonstration of epigenetics, which is telling you that every one of these cells, the muscle cells and the bone cells and the brain cells and the blood cells, every one of them have the same genes, the same DNA, but their destiny is different. Some of them became muscle, some of them became brain cells. So this process can be seen also in identical twins. They have been studied, identical twins, that actually was a pretty unethical study, and it was done many years ago, that they separated identical twins at birth. And many of them now are finding each other because they never knew they had an identical twin. And at birth, they separated them. They gave one of them to another family. They adopted them. And then they had this follow-up with these families, filling questionnaires about, development of this children and what diseases they get or whatever. And it was amazing that it showed that even though these are identical twins, just like having a copy of yourself, depending on what environment they were at, how much stress was in their environment, what kind of nutrition they had, what kind of lifestyle they had, they ended up having very different set of health issues, diseases, as opposed to if you kept these identical twins in the family they were born at, and they had similar environment, similar nutrition and everything. Their destiny was very much similar, as opposed to the ones that had been separated. So what happened in the ones that were separated? So for example, if an identical twin is adopted by a family which is poor, so the nutrition of that twin is very different. Say, the original family is well-to-do, their nutrition is very different. One is having McDonald's every day because it's cheap, and the other one is having healthier food and vegetables and stuff like that. Mm-hmm. Or I'm not stigmatizing poorness, but if they were adopted into a family who were smokers, and the patient, that twin, was exposed to a lot of smoking, secondhand smoking, or whatever it was that kind of completely changed the direction of their lifestyle. What happens is that, for example, in smokers, there are two major processes. I don't want to go too much into details because I want to keep it simple and understandable. But when we have genes, there is a chemical or molecule that we call it methyl, is H3C, that if attaches to a gene, it blocks the expression of a gene. So the process of methylation, which is attachment of methyl to a gene, covers or denies access of the proteins that are supposed to read this gene and transcribe it and copy it. It blocks it. And the opposite process, which is called demethylation, which is removing the methyl, exposes that gene to be read and to be copied and to be expressed. So now, depending on whether the gene is good or bad, then it can have two different outcomes. For example, BRCA is a good gene. It's a tumor suppressor gene when it's healthy. When a mutation happens in a lady or a gentleman who has a mutated BRCA gene, now this tumor suppressor gene is not functioning. It's not doing what it's supposed to do. It is not stopping uncontrolled division of the cells, and therefore they turn into a tumor. That is through a separate mechanism. That is through a mutation or a damage in the gene, in the DNA. But what makes the difference in two people who have the mutation, but one of them gets cancer, breast or ovarian, and the other one doesn't get it? This is where epigenetics comes in. So this BRCA, which is a good gene, if methylation happens, a methyl attaches to that gene, it covers that, it stops it from being expressed. So in this case, covering or blocking duplication of a gene that is good for you in terms of cancer, that stops cancer, is a bad thing happening. But if you have a type of gene that we call mutated oncogenes, oncogenes are genes that do the opposite of a tumor suppressor gene, meaning that they promote division of cells. Now, say we have a mutated oncogene. Now, if methylation happens, a methyl comes and attaches to the gene and blocks the transcription and reading of this bad gene, then something good has happened, because then this bad gene cannot express itself. There's also another protein called histone. These proteins are responsible for coiling of DNAs. A DNA, if you go to the base structure of it, it looks like a ladder. And I see something right behind Marielle that looks like ladder, but probably there are windows. I don't know what it is, but it is. It looks like all these squares and stuff like that. I can't hear you. Okay. So, but our DNA are not straight ladders. They're turned and twist like this, and then because of these proteins called histones, they coil around the histone. So they become a cluster of genes like that. And if you can imagine, accessing a gene within this coiled cluster of genes is very difficult. So they become inaccessible. They are difficult to read. So they will not be transcribed. They would not create the protein they're supposed to do. This process is very similar to methylation, because both of them result in blockage of reading of that particular gene. Now, if for whatever reason we had another chemical process happening to these histons, and the DNA uncoils, kind of opens up, then naturally it's easier to access the genes and read them. Did you have a question, Anne? For one reason, for one moment, your window was framed. Did you have a question? No? Okay. So these are really the mechanisms as how the genes can be expressed or not expressed. And that is how it's determined why two people with the same mutation, one of them gets it and one of them doesn't get it. So in epigenetics, there's a lot of attention going on to this science and research in epigenetics. They're basically studying, okay, what can we do? What are the changes that we can make in the lifestyle or in the environment to basically reduce the risk of cancer? And some of them are pretty clear, like, somebody who's smoking, somebody who is exposed to a lot of chemicals, somebody who's exposed to a lot of sunshine. But this process does start when we are a fetus in the womb of our mother. Our mother's stress, our mother's nutrition, our mother's environment changes the epigenetics of the fetus. So it starts way even before we have been born. And what is in some ways a double-edged sword is that some of these changes that happens in epigenetics, they are inheritable. You can pass that on to the next generation. Now, if that's a good change, if it has been something that is good and is for protection or reducing the risk of cancer, when this is passed on to the next generation, is a good thing. But if it's something that they puts them at higher risk of, for example, cancer or other diseases, then it's a bad thing. But we have both type of these changes. So for the most part, these changes as a result of environment and our lifestyle are reversible. So that's the good news, meaning that even if you were born with a bad epigenetics because your mother was, had a lot of stress or was drinking alcohol or smoking or drugs as you were in her womb, once you learn that your DNA and your genetics is not going to determine your destiny, and there are things that you can do to change your destiny as it comes to cancer or any other diseases or anything else in your life, then you become master of your own health and destiny. And that is, for example, the basis of the teachings of Dr. Dispenza. And what he and many others look at is how even our emotions and our thoughts are affecting our epigenetics. They have shown through science of epigenetics that trauma is intergenerational. So we inherit trauma from our ancestors. So not only we may have been exposed to our own traumas, we inherit traumas through our mother, through our father. It may go to 5 generations behind us. And by changing our epigenetics, then if we are unaware of it and we are not doing anything about it, it becomes our destiny. It becomes the same story repeating itself generation after generation after generation. Why? Because the language of our body, when it comes to trauma, the language of our body is our emotions. And the language of our brain or mind is our thoughts. And unfortunately, only 5% of things that we do consciously. 95% of it, if we are not self-conscious and intentionally try to expand our consciousness, 95% of things are happening unconsciously. That means we are programmed creators. So we wake up every morning and do the same thing, feel the same way, have the same thoughts, and this continues throughout the day. And then we go to bed with the same thoughts, with the same attitude, with the same emotions, day after day, year after year. And because of these traumas and negative emotions, and because our vibration level is low, because we are in survivor's mode, then we continue to create traumatic events in our own lives with bad marriages or whatever else that is, and re-traumatize ourselves. But the good news is that once you become aware of this, once you learn, I don't need to be a programmed computer and walk 95% of time unaware of what I'm doing or what I'm feeling or what I'm thinking, then I can expand my consciousness and live a conscious life. And the way it happens is by being present in the moment, being mindful of everything that we do. Because when you're programmed, your past is dictating your tomorrow and your next year and your 5 years from now. But when you become self-aware and present, and that is really what trauma does. Trauma, the way it acts is that it disconnects us from our authentic self. So it makes us more of unconscious beings, programmed beings, because we have a lot of trigger points that we want to avoid. We don't want to remember the traumas, the events that happens to us as a child. So every time it comes to our subconscious mind, we either intentionally suppress it, or our system, our psychological defense mechanisms, in order to reduce pain, they suppress them. So after a while, we don't have access to these painful emotions and events in our conscious mind. But nevertheless, they're running the show. They're running our life. Because, as Dr. Dispenza says, and many others say, If an animal is chased by a lion, we have two systems in our bodies. One is sympathetic and one is parasympathetic. Sympathetic system is designed for survival. Parasympathetic system is designed for being relaxed, having a life in peace. Now, when an animal is chased, they go into survival mode. Their sympathetic system becomes activated. And what it does, it shuts the circulation to many organs that are not necessary at the moment for fighting or fleeing. So they give a lot of circulation to our muscles. They increase our heart rate. They basically block our frontal lobe because it's not time for thinking or making a judgment. It's just time for reaction. So our frontal lobes are not working. They're not getting enough blood. The only things that are getting a lot of circulation are our muscles, our heart, and our adrenal glands that are secreting a lot of steroids, a lot of adrenaline, because we are ready to either fight or flight, depending on who is chasing us. Now, the animals, thankfully, they have a mechanism. They have been studied. Dr. Peter Levine has looked into this, who is a trauma expert, that these animals, when they reach safety, if they were not captured by the lion and they were not killed, once they reach safety, they have these shaking movements in their body, basically shaking it off, shaking that trauma off right there and then. And then they go right back into parasympathetic system. They enjoy eating or whatever they were doing before the trauma. It's just because they're safe. We human beings are not like that. Many times as babies, we have been in situations that we have perceived as a danger to our life, because a baby is 100% dependent on the parents. And if the parent doesn't feed them or doesn't love them or doesn't pay attention to them or doesn't change their diaper or whatever, they're gonna die. So the moment the mother is not paying attention to their cries, or the moment they're hungry and nobody is feeding them, they go into, we have been through this, we go into survival mode. And unfortunately, the traumas that happen, especially within the first 6 years of life, they keep us stuck in the survival mode. Now imagine living the rest of our life in survival mode. That means having a lot of steroids in our body, shallow breathing, higher heart rate, a frontal lobe that is blocked, not really making good judgments, living in fear, always looking at our back as if somebody's chasing us, as if we are the animal and the lion is chasing us for 60 years. That changes the entire chemistry of our body. Inside our skin, there are billions of cells. But these cells are all nourished by circulation, by our blood. And whatever type of hormones are in our bloods, or nutrients, or chemicals, cells are going to receive it. So Dr. Bruce Lipton, who was one of the pioneers in epigenetics, he put some cells in different petri dishes, and depending on the environment that he created in these different petri dishes, saw and showed that these cells they're just identical cells, just like a fetus or zygote. But when he placed them in different environments, they turn into different things. And that is when the genetic determination or determinism, meaning that your genes are going to determine who you're going to become, that myth was broken. No, you can. And he did the opposite of it. He put some of these cells in a stressed, bad environment that these cells got sick. He didn't treat the sick cells with medications. All he did, he removed them from that environment and put them in a healthy environment. And the cells took care of themselves. They became healthy. Our cells are intelligent. Our bodies are brilliant. And that's promising, because that means that if we take care of our traumas, if we change the chemistry of our body, we are a huge petri dish with billions of cells in there. Now, if we were, because of trauma or what we ate or chemicals in our environment, we got sick, the Western medicine wants to fix it is by giving you some additional chemicals in the form of medication. And it's one of the things that Dr. Gabor Mate says, who is another genius in treating trauma. He says that, for example, autoimmune diseases are as a result of stress, or asthma is as a result of stress. And then these very diseases that have been as a result of stress, they are treated with steroids. We give steroids to people who have gotten sick because their steroid levels has been high to begin with, because they have been living in survival mode. That's why it doesn't work. So what we can do for ourselves is by healing our traumas, by removing insulting factors in our environment, whether it's chemicals, whether it's smoking, whether it's alcohol, whether it's inactivity, whatever, change the epigenetics of our bodies. And we can reverse every disease process, including cancer. Not consciously, I'm not going to sit here and say, okay, man. But there are things that we can do. Like when you do meditate, you're bringing your stress hormones down. When you do deep breathing, which is the opposite of what trauma does, you are oxygenating your cells, who are often hypoxic. They don't have enough oxygen because we have shallow breathing when we're traumatized and when we're stressed. So we're 10 minutes to 3, and I want to open it to discussion. But science of epigenetics is amazing, and one of the reasons that we are starting this 12-week cancer trauma relief pilot is that MAP is an amazing, amazing, amazing and groundbreaking technique for removing the stress and the negative emotions attached to our traumas. We cannot change the events of our life. They have happened. What we can change is how we react to them. Are we going to continue to live in survivor mode, or are we going to do something about it to change the environment of our bodies so our self can heal themselves? So here I open to comments and questions. I hope this was understandable and simple enough.
Yeah, it was really informative. I've watched Bruce Lipton quite a bit, to be fair, and he's a plethora of knowledge on epigenetics. And before you mentioned him, I was thinking of the experiment that I'd heard where he had the three petri dishes and he got the same cells, but the environment was different and they'd all responded differently. So I made a little note because I didn't know if you knew about Bruce Lipton, so I just made a note. I thought I must tell you about Bruce Lipton if you haven't heard of him. Yeah, he's absolutely wonderful. And I've got my
He's
best my
one
best
one
friend.
of the many. Thankfully, we have a lot of people who are now paying
Mm,
attention to.
yeah, I mean my best friends are identical twins,
Uh,
and they were from the same placenta. So there was just the one placenta. I can tell them apart because I've known them for many years,
yeah.
but it's quite an eye opener to see the two of them, even though they're together every day. They even left school and trained the same teacher training. They even teach at the same school, the same stuff, the same age group of children, but they have different things. One of them has a breast cancer. One of them has this thing where they can't. They thought it was POTS, but it's something to do with the pressure and the cerebral spinal fluid. So she struggles to stand up for a period of time. She has to lie down because of the pressure for a brain sinking or something.
Okay.
So the two of them, obviously with their mum, they grew up with the same stuff, but then they get married,
Ah,
and they are both of them. They're going to be subjected to different partners, to different ways of being.
oh,
To
absolutely, absolutely.
yeah, and
Yeah.
it's amazing to see because knowing about mental health, I kind of know both of them, and I think, yeah, I've got a good idea about the breast cancer and why it would be there, and the same with the head and why it would be there. They're just not open to this sort of thing. So I find it's hard for me. It's hard for me. But yeah, I can see it, and I completely get what you're saying. If we change the environment that our bodies are in, then the cells will change, and it's a whole new story.
Just think about stem cells,
Mm.
stem cell transplant. Stem cells are all identical. When
Mm.
they inject stem cell into somebody's body, they're all identical. But they go and find, they have a divine intelligence. They go and find where there is a problem.
Mm.
And they can go in the brain and become neurons, or they can go into breast and become breast cells. They go where they need to go.
Mm. Yeah, my brother had some stem cells. He has multiple myeloma,
Mm-hmm.
and he was diagnosed in 2009, and
Mm-hmm.
he's still alive, which is unusual. It's very unusual for
Mm-hmm.
him, for someone to still be here after that length of time.
That's great. That's wonderful.
So yeah, yeah.
So one of the things, for example, Dr. Gabor Mate asked in his life retreats, he asks, so how many of you have been to a specialist last year? Well, people, most of hands go up. either for checkup or for whatever reason, we have been to a doctor. And then he would ask, how many of you were asked whether you had trauma in your childhood or adulthood? And nobody's hand goes up. Because despite the wealth of data and science in epigenetics, unfortunately, in Western medicine, they still think there's the minds are separate from bodies. And nowadays, I mean, if they are very good, they may ask you whether you're depressed or whether you're at risk of suicide, and they leave it at there. Just if they're very good, they may screen you for depression. That's all. But I don't know of any oncologist who sits down with the cancer patient and said, okay, let's talk about your childhood traumas, and let's talk about your adulthood traumas, and let's try to change the environment your cells are living in.
Yeah. And those doctors who do refer patients on with mental health, they tend to send them for work in the cognitive area of the brain, which isn't going to actually make the changes necessary that's required to
Yeah, I mean, I'm familiar with Dr. Gabor Mate, Compassionate Inquiry, and familiar with Dr. Peter Levine, SE, which is somatic experience. What they really invite to do is to feel the things that we don't want to feel, and feel it and pay attention where in our body we're feeling it. If you're sad, where are you feeling it?
Yeah.
If you're feeling a fear, where you're feeling it. And then they have these techniques that basically support you to experience that sadness or fear or whatever it is, and release it.
Yeah.
But therapy, which I have been through 30 years of it, does the opposite. You go there and you just talk to somebody who doesn't give you any feedback. They usually sit and just listen for 45 minutes. And then at 45 minutes, said, okay, time is over. I'll see you next week. They create this dependency, and I'm not blaming them. It's just their educational system that has created them this way. They either give you a pill when you're sad. Oh, you're sad? Here it is. Take this prescription. Or you go for 30 years and you just repeat your stories and re-traumatize yourself year after year after year without actually making a difference.
Yeah, it just compounds. It compounds the trauma, doesn't it?
Yes, many of them. I mean, with SE and Compassionate Inquiry, they ask every single time whether it's okay. Okay, you're feeling, how are you feeling? I'm feeling sad. Okay. Because there are times that trauma is overwhelming. So they ask the patient, is it okay to go there? Is it okay to feel it? Is it okay if we work with that? And the patient, if they feel safe with their therapist or are not overwhelmed or flooded, they give consent to continue, or they may say, no, I don't want to do this now. I can't. Yeah. So it's a very gentle process by someone who really, really needs to know. Both of these techniques, somatic experience and compassionate inquiry, needs at least a year of training hands-on training before they can start dealing with trauma patients.
Yeah, yeah. Thank you.
Anyhow, if there's no other comment or question, thank you very much for joining me today. And I'm very excited that next Sunday we will start the cancer trauma relief pilot. But I will be here again on Saturday for the cancer education program. And we will continue our discussion about what is cancer. Today was a transition from, black and white Western medicine into, or, genetic determinism into things that we can do, mastery of our own health, how we can change our own destiny despite our genes, and hopefully make good enough changes in our epigenetics that it's too late for me, but give it to the next generation. But thank you very much for being here. Thanks for your time.
Thank you.
Thank you.
Thank you very much.
We appreciate you taking the time off your Saturday, and enjoy the rest of your weekend.
It was very interesting. Thank you.
Take care. Bye.
Bye.
Bye-bye.
Bye.
Hi, my name is Dr. Nushini Zadeh Farhart. I'm a radiation oncologist currently practicing in Houston metropolitan area. And I would like to say welcome to those of you who have signed up for our cancer trauma relief pilot, which is a collaboration between me and MAP Coaching Institute. MAP stands for Make Anything Possible. It's a groundbreaking technique founded by Mrs. Colette Stryker, psychologist, and her son. We are going to use MAP to remove the traumas you have experienced as a result of your diagnosis of cancer, which by its nature, MAP doesn't stop there, goes in and removes and treats all similar and associated traumas. Once this 12-week program ends, we will make it into a comprehensive program that includes not only recordings of these 12 weeks, but also recordings of my cancer education program around the topic of what is cancer, which I dissect and simplify for everyone to understand from different perspectives, from perspective of Western medicine, from perspective of complementary medicine. We talk about epigenetics. We talk about how our childhood and adulthood traumas made us sick to begin with. The program would also include subliminals that you can listen to. It also includes another program called Beautiful Beginnings that basically addresses the childhood traumas more directly. This is a once in a lifetime opportunity. Both me and Colette are extremely busy. And to have both of us for 12 weeks every Sunday for an hour, it's not going to happen again. We're going to just do it once. And we have only a few seats left. I hope those of you who have been undecided join us. We will start our program next week on Sunday of next week, May 16th. And you don't have to be present for all of them. I hope that you are, because you can interact with Colette directly, which is a priceless opportunity. But if you miss one of the sessions, get the recording of it. And MAP is just as effective through a recording of a session as it is in a live session. So I look forward to next Sunday. Thank you very much for joining us. And I look forward to meeting every one of you.